One of the most frequent calls we get from families is about childcare, daycare settings. Parents are just having a very hard time finding childcare for their children with special needs and special health care needs. And they call us we're kind of a last resort because the parents have been looking and are not successful in locating anything. And some of the issues they're having, I would say one of the biggest one is toileting. You know, so many of these kids that have special needs and special health care needs are not toilet trained, and daycare centers just will not take them. They're not trained. They just won't do it. Another issue that parents call us with are for children that have behavior issues. And some of these kids are on the autistic spectrum, and some are not diagnosed yet. But a lot of people, either if they are diagnosed or not diagnosed yet, a lot of people just look at these kids as behavior issues. So the parents are getting called in the middle of the day to come pick their kids up from the daycare because there's behavior issues and the staff is not trained on how to deal with these children. Or parents are just getting calls and saying your child's not accepted here anymore. They can't come here anymore. And kids are getting kicked out of daycare When centers. It comes to any kind of insulin, if the child's diabetic, the daycare center wants nothing to do with it. And physical, if a child has a physical handicap, the daycare centers are just not equipped and not trained to deal with that. So these parents are desperate and have nowhere for their kids to go. So these parents can't work. And some other phone calls I get, it's not just from families. We get a lot of phone calls from providers. And some of these daycare providers call us asking us where to get training because they want to be able to take these kids and help these families and have a safe environment for these children. We do speak to policymakers, and we do encourage parents, and we train parents to speak to policymakers, because that's where change comes in, is when they hear from families. Just say to them, we need a safe environment for our children that have special needs, and make it a requirement. We already know that there is certain requirements in place for child care centers in the state of Connecticut, but make it an additional requirement for them to get training to have them have the ability to have children with special health care needs in their daycare centers so parents can work.